Hi guys, welcome to our gross anatomy lecture. Today we're going to talk about the lateral compartment of the forearm. It doesn't have much, but it's a very important compartment that you need to appreciate. Right. So in the lateral compartment, right here, you're actually going to have two muscles. Right, two muscles. If you remember very well, um, we said that we have the interosseous membrane, the intermuscular septum anterior and posterior, that are going to divide the forearm into three: in anterior compartment, posterior compartment, and lateral compartment. But some texts they just divide it into an anterior and posterior. But in terms of the nervous supply, it's very important to take respect to the lateral compartment. Right. So the lateral compartment has two muscles which are very important: your brachioradialis muscle and your extensor carpi radialis longus. So right here, that's your brachioradialis muscle, originate from there. Uh, the lateral supracondylar ridge, and it sits on the stylo process of your radius. Right here, this muscle is actually very important because it has the following actions. Right, so it actually flexes the forearm at the elbow joint and rotates the forearm to the mid prone position. So mid prone position as well as flexion of the forearm at the elbow joint. That's the function of the brachioradialis muscle. And then another muscle is going to be your extensor carpi radialis muscle right here. So your extensor carpi radialis muscle, it originates from the the lateral supracondylar ridge of the radius, and it sits on the base of the second metacarpal right here. The base of the second metacarpal right here. So this is your extensor carpi radialis longus. It's also very important for another way for you to differentiate it from the brevis is that the extensor carpi radialis longus, it's a bit slender and long, while the brevis is short and bulky and broad. You understand? Good. So what is going to be the nerve supply to the lateral compartment? That's going to be your radial nerve before it bifurcates. So you have the radial nerve, right? That will be supplying. So remember when the radial nerve, um, let's take a look. When the radial nerve pierces the lateral intermuscular septum of the arm, it gets into the anterior compartment. Right in the anterior compartment of the forearm, before it enters the cubital fossa, that's why it gives muscular branches, one to the brachialis muscle, which we said it also received dual innervation, another branch to the brachioradialis muscle, and another branch to the extensor carpi radialis muscle. So that's going to be your your radial nerve, right? Innervation of the lateral compartment. As for the blood supply of the lateral compartment, you're going to have branches of the radial artery itself and branching from the brachial artery, which are also going to form the elbow anastomosis. So those are important branches that will supply your lateral compartment. So that's everything that you have to learn on the lateral compartment. Thank you so much. Take care. See you next time.